Good afternoon, everyone, and thank you for joining us. Can I start by offering my condolences to the families and friends of the 98 Australians that lost their lives yesterday in this pandemic as a result of COVID-19. Yesterday was the deadliest day of the pandemic in Australia so far. That is a hard, unavoidable and very uncomfortable fact. Just as it's a fact that while the death rate from Omicron is lower, it spreads so fast and therefore as a result the death toll is higher. This morning I convened a meeting of the State Disaster Council of Cabinet. Given our ongoing COVID outbreak in WA and our transition to Omicron-ready settings, the meeting finalised several issues that have been worked through following consultation and a close assessment of how things have played out in the eastern states. This all relates to WA's future high caseload settings for close contacts, testing and isolation protocols and critical worker guidelines. Everyone has seen what has happened on the East Coast for the past 2 months. We saw the chaos, uncertainty and confusion over Christmas and early January when Omicron suddenly surged around the nation. As the Prime Minister said, Omicron is a game changer. It is so infectious and it's overwhelmed systems over East, systems that were set up for Delta. The strategies for managing Delta are not viable when Omicron takes hold of a community and we see thousands of daily cases. Omicron infected tens of thousands daily, requiring the isolation of tens of thousands more, meaning workplaces and supply chains were dramatically affected. We want to do what we can to minimise those impacts, and the benefit of our approach is that we have the ability to mitigate the problems seen in other jurisdictions by having the right settings in place at the right time instead of chopping and changing rapidly when it's all too late. To start, I'll provide a COVID update. Up to 8 p.m. last night, WA Health recorded 9 new local cases. All 9 cases are linked to the current Omicron outbreak. One case is a close contact linked to the Willagee IGA subcluster. 3 are linked to the nightclub cluster, 2 from the Library nightclub and 1 from the Hippie club. 1 is a close contact of the Coolbellup cluster. 2 cases are from the Wheatbelt, 1 in Cunderdin and 1 in Goomalling. And 2 cases are under investigation to pinpoint the source of infection. All cases are now in quarantine and Public Health continue to investigate and monitor them. Several of today's cases have been infectious while in the community. Contact tracers are working with these cases to determine potential public exposure sites, and these will be uploaded to the Healthy WA website when confirmed. WA Health is also reporting 1 case who is an interstate traveller. There are currently 114 confirmed active cases in WA. Of these, 13 are in hotel quarantine, 99 are in self-quarantine, and 2 are in hospital. A total of 7,497 people were tested at WA clinics yesterday, which is higher than the day prior, but we would still like to see that number grow. Anyone in the Perth, Peel, Wheatbelt and Southwest regions, particularly the Greater Bunbury area, experiencing any symptoms should get tested immediately and isolate until they receive a negative result. WA Health is also in contact with a ship en route to Bunbury. The MV Ballard has a crew of 23, 8 of whom are reporting positive rat tests and are now isolating in their cabins. WA Health and authorities will continue to monitor this ship and its crew from afar. This is in addition to the 2 other ships currently being monitored. These numbers this far into an Omicron outbreak are pleasing, but I don't want people to think it's over and time to get complacent. The numbers will rise, but it is easier to keep it under control with lighter restrictions than if we had hundreds of new cases arriving on planes each and every day without proper safety measures in place. With the Omicron variant, we know it is impossible to eliminate and it spreads fast. At some point in the future, we will inevitably be in a higher caseload environment. As we have seen on the East Coast, when it is that prevalent, we need to have different isolation guidelines for critical workers and the general public and workforce. To strike the right balance between suppressing the virus and allowing society to function as smoothly as possible. There are two things to note. Firstly, WA is not currently in the environment that requires these new settings. Right now, the virus is still at manageable levels. And as such, it is best to keep our current protocols that help suppress the virus. For example, New South Wales moved to these new types of settings when they recorded 21,000 new daily cases. Today, in Western Australia, we have 9 cases. Now, of course, we will bring these into force way before we reach the New South Wales type case numbers. That's the benefit of our transition plan, as we can learn from the experience of other states. Secondly, Western Australia's higher caseload rules, when they kick in, will be broadly aligned with other jurisdictions, but with some common sense adjustments to suit Western Australia. So today, we can detail the future settings to give the community, businesses and industries the opportunity to plan and prepare for our transition to managing higher levels of daily cases. To be clear, for the time being, the current isolation and close contact rules still apply. However, when WA reaches a higher caseload environment, we will move to the new settings. Firstly, casual contacts will no longer be considered. That means being at an exposure site at the same time as a positive case will not be a reason for enforced testing and isolation. That being said, it's important to keep checking in at venues in the future. Because if you've been to an exposure site, it's important to monitor for symptoms, and in the event you develop them, go and get tested. Second, the definition for close contacts will change. Close contacts being the people around a positive case who are required to get tested and isolate for 14 days in order to slow the spread of the virus. In a high caseload environment, a close contact will be defined in Western Australia as a household member or intimate partner of a person with COVID-19 that has had contact with them during their infectious period, or someone who has had close personal interaction with a person with COVID-19 during their infectious period. A close personal interaction is defined as having had 15 minutes of face-to-face contact where a mask was not worn by either person, or having spent more than 2 hours in a small room with a case during their infectious period where masks have been removed for this period, or someone who has been notified by WA Health that they are a close contact based on specific circumstances. Our approach is broadly aligned with South Australia's approach. However, we will no longer take casual contacts into account. The approaches in states like New South Wales and Victoria are much looser. Only household or household-like contacts of a confirmed positive case are declared close contacts and are required to isolate and get tested. But again, we have the opportunity to watch and learn and strike the right balance unique to Western Australia. So just to indicate how this differs, if you go and get dinner with a friend at a restaurant where masks are off as you eat and drink, it goes longer than 15 minutes and one person later tests positive for COVID-19, in Western Australia, the other person is designated a close contact and must isolate and get tested. In Sydney, they are not required to self-isolate or be tested, meaning they are more likely to continue to spread the virus in their workplace or social circles. But at the same time, if you were to get a single case in an office, our WA rules don't necessarily mean the entire office needs to shut. I think most would agree the West Australian definition is better for limiting the spread of the virus in the community and ensuring people are incentivised to do the right thing while also ensuring that things can continue safely to operate. We are trying to control and manage the risk in a sensible way. Thirdly, in a higher caseload environment, WA will also have new testing and isolation protocols. For positive cases, close contacts, both symptomatic and asymptomatic, and specific guidelines for critical workers. In other words, What do you do if you get COVID or are designated a close contact in the future? Now, it's quite detailed, so it's important to note that all the information will be presented clearly at wa.gov.au and on social media. Firstly, confirmed positive cases will need to self-isolate for a minimum of 7 days instead of the current 14 days. If symptoms are still present, they will need to keep isolating until they recover. If their symptoms have passed, they can leave isolation and no test is required after 7 days. If you are a symptomatic close contact, in other words, you're a close contact showing symptoms, self-isolate for 7 days from the date of contact with the positive case. Take a PCR or RAT test on day 1 or as soon as possible. If it's positive, follow the positive case protocols. If negative, stay in isolation, take another RAT test in 24 hours. If still negative, take a final RAT test on day 7 before leaving isolation if the result is negative. If you are an asymptomatic close contact, so you're designated a close contact but you don't have any cold or flu-like symptoms, self-isolate for 7 days from the date of contact with the positive case. If symptoms develop prior to day 7, take a PCR or RAT test. If still asymptomatic and not positive, take a RAT test on day 7, and if negative, you can leave isolation. For any close contact, it's important to remember that even after you've left isolation after 7 days, it's important you monitor for symptoms for the next 7 days as an extra precaution. All of this is up on the wa.gov.au website and graphically on Facebook, so it's a bit easier to understand. Changing the definitions and the isolation protocols in the future is all based on expert health advice and gives us the best chance to balance the community risk and the need to reduce the impact on businesses and the daily life of West Australians. Finally, in the event of a very high caseload environment, in order to ensure continuity of essential operations by alleviating workforce shortages in those operations, certain workers will be designated as critical workers. And in the event a critical worker is designated as a close contact, but they have no symptoms, they will be able to continue to work with strict conditions. This is not designed to allow normal business activities to keep going. This is a measure of last resort to ensure we keep our state running. The worker must be asymptomatic and cannot undertake their role from home, and either performs a role that is critical to the COVID-19 response or continuation of critical services that prevent significant harm, e.g. loss of life, catastrophic impacts to safety or welfare, lack of access to essential goods to an individual or the community. Or performs a role that is necessary for the safe continuation of services and/or has specialist skills in one of the following industries: transport, freight and logistics, including public transport; food, beverage and pharmaceutical manufacturing, supply and retailing; petrol stations and truck stops; agriculture; critical resources, power, utilities and waste management services; corrective and judicial services; police and emergency services; schools and childcare; healthcare services; social assistance and residential care; veterinary services; funeral, crematorium and cemetery services; and defence and defence-related industry. Inside those industries, there are categories of roles that are considered critical that will be up online soon. In the event those criteria are met, the worker can then keep working with the following requirements: return a negative RAT test daily, wear a surgical mask when outside the home, travel alone if possible, and isolate when outside of work. In the event symptoms develop, they must stop working and follow the symptomatic close contact rules. In the event they return a positive RAT test, they are then a positive case and must follow the positive case rules. Workplaces will be required to determine the number of critical roles based on the state government guidelines. Employers must register this information with the state government. An online registration system will be set up ahead of the settings coming into place. Once again, these rules strike the right balance for WA when we reach a very high caseload environment. WA's critical worker definitions are broadly aligned with national guidelines, with enhanced RAT testing protocols and adjustments for WA's critical industries. As you can see, whilst we still use PCR testing, while our supply and capacity allows, we will continue with this approach. RAT tests will eventually become a diagnostic tool. Ahead of the new settings coming into place, positive RAT tests will need to be reported to the state government to help ensure we can keep track of cases and manage the spread of Omicron. All of these protocols will only come into effect when WA reaches a high caseload environment based on the Chief Health Officer's advice. There is no hard number of cases that define what a high caseload environment is. It would be a combination of average case numbers, the extent to which they can be linked, and the amount of time cases are infectious in the community. Hopefully it is weeks away whilst we improve our third dose vaccination rates, depending on how our current outbreak plays out. We know that under Omicron, spread of the virus is unavoidable. But by virtue of our current low caseload, existing border controls, and our learnings from other jurisdictions, we can try to slow the spread of Omicron. To avoid the worst of the virus and forcing too much of our workforce into isolation at any one time. Under these settings, one case in a bar will not shut a bar. One case would likely not shut an office or a warehouse. We rebalance the risk for the environment that we are in. By announcing the rules now, everyone knows what will be required. We are providing certainty as much as we can in a very uncertain environment. In the meantime, the best thing everyone needs to do is go and get their third dose vaccination. As of yesterday, WA's third dose vaccination rate is at 33.9%. That has grown over 25% in the past month. That's how quickly it's rocketing up. So please, to everyone who hasn't yet booked in for their third dose, take the opportunity now to have the best possible protection from Omicron. I'll now hand over to the Health Minister and then the Education Minister, who will walk you through the specific settings as they apply to schools. Thank you.
Thank you, Premier, and good afternoon. I'd like to start by reiterating how important it is to get tested if you have been to any of the exposure sites or you are feeling unwell. The list of exposure sites continues to be updated on the Healthy WA and wa.gov.au websites every day and several times a day. It is extremely important that if you have visited one of these sites that you follow the health directions and get tested. Please check the websites regularly. Today we are also announcing the WA COVID Care at Home program, which will begin on Monday. The WA COVID Care at Home will deliver monitoring care for COVID positive patients and COVID positive people in their own homes. It will enrol COVID positive patients based on risk factors such as age, vaccination status, severity of symptoms and medical history. Patients will receive regular daily contact from the healthcare team to check their vital health signs and welfare. They will also monitor their general well-being. The healthcare team will include GPs and nurses who are based interstate and have experience with dealing with COVID-19. If they have concerns, they will escalate the patient for more acute care at hospital if needed. Anyone who needs hospital treatment will absolutely get it. The patient should also be able to avoid the emergency department, as COVID at Home team will facilitate their transfer directly to the hospital. Not all patients will need to access this service. It will primarily be used to assist those with chronic conditions or, in some circumstances, pregnant women. Similar programs are operating interstate and overseas, and WA Health will work in partnership with Calvary and Medibank to combine their clinical and telehealth experience. We are taking a stepped approach to ensure all West Australians who get COVID can access the kind of care that they need. Many people will be able to look after themselves at home with the assistance of their GP, and others will benefit from COVID at Home program, while others may still, unfortunately, require hospitalisation. But with our high rates of vaccination, we hope these people will be the few. Now, pleasingly, our vaccination rates continue to climb, and we now have a first dose rate of 97.4% and a second dose rate of 90.5%. From Monday, even more West Australians will start to become eligible for the third dose, with the recommended gap between the second and third doses reducing to 3 months. A third dose is the best protection we have against Omicron. I'd urge all West Australians to get a third dose as soon as you become eligible. There are clinics across the state at the ready, so please make a booking via Vaccinate WA. Our third dose rate also continues to grow, so let's keep that up. It's up at 33.9% of over 16s. Also on Monday, as previously announced, the expanded proof of vaccination requirements will come into effect. Proof of double dose vaccination will be required at a range of venues across the state for those over 16. The venues are visitors to public and private hospitals and aged care facilities, all hospitality venues including restaurants, cafes, bars, pubs, clubs, taverns, nightclubs and dine-in fast food. Roadhouses, service stations and takeaway are exempt. Indoor entertainment venues including indoor play centres, gaming and gambling, theatres, concert halls, museums, cinemas, live music and bottle shops, the entire Crown complex. Major stadiums, gyms, fitness centres and health studios, amusement parks and the zoo, music festivals and large events with more than 500 people unless they are exempt, community sport and school-based events unless at one of the specific venues listed are exempt from the proof of vaccination requirement. Venues, staff and patrons will have a shared responsibility when it comes to proof of vaccinations, with venues required to take reasonable steps to ensure that all patrons are double dose vaccinated or exempt. The easiest way to demonstrate your proof of vaccination is by using Service WA app. And if you haven't already, I'd urge you to download and register it today. You only have to set it up once. There are guides on the wa.gov.au website to help you do this, or you can call 1333 WA. Thank you. I'll hand over now to the Minister for Education.
Good afternoon. Today we're announcing the school and early years, that's childcare, close contact definitions that will apply as part of our plans when we reach those high case numbers in the community that the Premier mentioned. These arrangements will apply to public and private schools and are on the advice of the Chief Health Officer. Minister McGowan, as the Minister for Communities, will liaise directly with the early years, that's the childcare sector, on how these will be operationalised in that sector. I'm going to talk to you about how they will apply in the school sector. These definitions are different to the definitions that will apply to the general community to take account of the importance of keeping our schools open and providing face-to-face learning to students, and that the work in schools and early years is close. This is so important to children's learning, social and emotional development, overall well-being and physical and mental health. Schools will be the first to open and the last to close. Face-to-face learning is our priority. Today's announcement is on top of all of the measures that are already in place to keep schools safe and to reduce the risk of transmission. There will be further measures, for example, around keeping groups of students separate from each other where that's practicable. But today is about the definitions of close contact. These definitions are based on those adopted by South Australia for schools and early learning. While South Australia's will apply from when their school returns because they have high daily cases, and I note they have delayed the full return to school, this plan for WA will apply once WA records high daily cases and the other factors that the Premier referred to, and on the advice of the Chief Health Officer. Our 3 new contact definitions will ensure that schools can stay open. Our WA definitions are stricter than the national definition, which defines close contact as someone in the immediate household and does not take account of the nature of the work in schools and early years settings. These new definitions mean we will not be closing schools. The 3 school and early years definitions will be classroom contact. Staff and students have shared a classroom for a minimum of a period with someone who has tested positive for COVID-19, such as another student, teacher, support worker or ancillary staff. One-on-one contact. Student and staff that have worked one-on-one and face masks were not consistently worn. In the event that one of them has tested positive for COVID-19, for example, an education assistant or staff member in a special education school who has worked closely with a student with a disability. The third definition is workplace contact. Staff or other worker who spends more than 15 minutes indoors in close proximity and not wearing a mask with another adult who has tested positive for COVID-19. The isolation, quarantine and testing protocols, depending on the nature of the school-based close contact, is as follows, and please bear with me. A positive case, as determined either by a RAT or PCR. The protocol is that they isolate for 7 days from the day of the positive test. If there are no symptoms at day 7, they can exit isolation. If symptomatic after 7 days, remain in isolation until symptoms have resolved. Asymptomatic one-on-one. That's the example of an education assistant working with a student with a disability who cannot regulate their behaviour. Quarantine for 7 days. If no symptoms at day 7 and a negative RAT, they can exit quarantine. If any symptoms develop, test and follow the protocols for school-based close contacts who become symptomatic. Asymptomatic classroom or workplace contact, a teacher, for example, or an education assistant. The staff member takes a RAT daily for 7 days and quarantines when not at work. Wear a surgical mask and travel alone to work if it's possible. If symptoms develop or you have a positive test, follow the protocols for school-based close contacts who become symptomatic. If any symptoms develop, test and follow the protocols for school-based close contacts who become symptomatic. Asymptomatic classroom contacts, a student. Students, aside from positive cases, will be encouraged to continue attending school if they do not have any symptoms. Students who are asymptomatic classroom contacts should avoid, if possible, out-of-hours childcare, extracurricular activities, or public transport for 7 days. If any symptoms develop, test and follow the protocols for school-based close contacts who become symptomatic. Asymptomatic workplace contacts, non-critical worker. As an example, someone who is not a direct employee of the school but is at the school. Quarantine for 7 days with RAT or a PCR test on day 6. If the test is negative, can exit quarantine on day 7. After completing quarantine, monitor for symptoms for a further 7 days. If any symptoms develop, test and follow the protocols for school-based close contacts who become symptomatic. School-based close contacts who become symptomatic. Remain in isolation and get tested by RAT or PCR test. If positive, follow the guidance for a positive case. If negative, repeat the test 24 hours later. If again negative, continue the guidance for the appropriate form of asymptomatic contacts above. Symptomatic, but not a school-based close contact. A PCR test is preferred while lab capacity allows, otherwise complete a RAT. If negative by RAT, isolate for 24 hours, then retake a RAT. If positive, follow the protocol for a positive case. If the second RAT is negative, no requirement to isolate. So to summarise, we will not be closing schools. Asymptomatic students will be encouraged to continue attending school, but with some restrictions where that is possible. For example, not participating in external activities and not using public transport. Asymptomatic staff in that one-on-one setting where mask wearing is harder to manage will quarantine for 7 days. and an asymptomatic classroom or workplace contact will attend work, take a daily RAT test and quarantine when not at work. The state will provide the necessary RATs for this to all schools. At this point, the use of RATs in schools will be for managing the policy in respect to staff. However, I note that Victoria and New South Wales are returning to school with a 4-week trial of the use of RATs as a surveillance tool for students as well. That's the twice-a-week RAT for all students and staff. We will give further consideration to the broader use of RATs over the next few weeks based on Chief Health Officer advice and observations on how those pilots work. I reiterate, this plan takes effect on CHO advice when the other factors that the Premier has outlined kick in, when we get to those high case numbers in the community. This is not happening when school returns on Monday. It does recognise that schools and early years services are critical, providing face-to-face learning to students for their social development and their mental health, and supporting the economy so parents can work. Our plans and these definitions are stricter than the national definitions. We have the ability here in Western Australia, because of the decisions that we have taken and the hard work and cooperation of West Australians, to be proactive in setting these definitions before we get to high community cases that Omicron will present. Our Eastern States colleagues had to create the definitions to reactively adjust. They've had to retrofit managing the impact of furloughing. The national definitions reflect that. We have the opportunity here in WA to learn from them and from the interventions that South Australia did before their case numbers reached the same levels as New South Wales, for example. I'll leave my comments there and I'll hand back to the Premier for taking questions, and I'll be available after that.
Thanks very much, Ministers. It was very comprehensive.
Very. Why not just stick with the close contact definitions that was agreed at National Cabinet on December 30?
So there were some national guidelines that were particularly applicable to New South Wales and Victoria. South Australia has done something different. And what we found is the spread of the virus in South Australia has been impacted by some of the things they've put in, and that is they've reduced the spread of the virus because they've adopted different guidelines in a range of ways, both these and public health social measures, to the national guidelines. We've had the opportunity to look at what has been put in place nationally and the South Australian guidelines, and perhaps adopt a middle course between the two. Now, the national guidelines, or the rules that were put in place, were largely around New South Wales and Victoria, which had tens of thousands of cases a day, massive spread of the virus. So they basically had all sorts of industries basically closing down, and huge furloughing of hospital and school staff, massive absenteeism across the community. So they had to put in less cautious measures because of that. Now, we have had the time to analyse, and because we can put in place our measures at the appropriate time and the right public health social measures to hopefully reduce the spread, plus higher vaccination levels of third doses, we're able to adopt a measure or a set of measures which are more cautious, mean hopefully lesser spread of the virus, and reduce the rates of spread, therefore the rates of absenteeism.
You said there's no hard and fast number that equals a high caseload. Have you asked the Chief Health Officer for a ballpark figure?
Yeah, it's very difficult to set that. Now, what happened over East, just so you understand, when they brought in their close contact rules and isolation requirements and the like, New South Wales was at 21,000 cases a day, plus 834 hospitalisations. Victoria was at 5,900 cases a day, 428 hospitalisations. So it was a very different environment to what we're experiencing. So what we'll do, we will analyse case numbers, analyse the extent to which they are linked or the source of infection is known, the extent to which they are impacting on high-risk settings, including residential aged care, prisons, essential workforces and the like, and the total amount of time cases are infectious in the community before putting in place our new rules. So you can't put in place a hard and fast rule because there's so many factors, based upon numbers, because there's so many factors to take into account. It would basically be irresponsible and reckless to put in place a hard rule because there are so many variables we can take into account. But we're watching what's happened over East. Obviously, we'll do it before such time as New South Wales and Victoria, but they did. But clearly, we'll take into account all of those factors plus the health advice we receive.
So given that companies, so right now, companies have told a lot of workers to stay at home or out of the building in some form. Well, Channel 9 is one of them, as an example. And that's because of the 14-day isolation rule, and obviously what's deemed to be a close contact. And yet, we don't have much of the spread of, as an explosion of Omicron that we will require to come back to 7. My point is, how is that helpful right now to all those businesses that have put all these measures in place to keep people away, because your rules are still in place for 14 days and isolation and close contact rules?
The absenteeism and furloughing in Western Australia is a fraction of what is going on over East. A tiny fraction. We had, 9 local cases today. New South Wales had many thousands, and so did Victoria. So by having the 14-day rule and the existing close contact rules, we're reducing the spread of the virus. And by reducing the spread of the virus, we're actually getting third dose rates up and kids rates up at the same time. So the whole thing is a big balancing act between all of these things. If we put in place these new close contact rules, the new isolation and quarantining requirements, the critical worker rules and so forth, they are for a higher caseload environment when you need people in, who are perhaps more risky to be at work and doing their jobs. At this point in time, that is not the situation in Western Australia.
Will these all kick in at once, or are we likely to see different industries move into these rules at different times?
No, the rules would, well, it's a complex question. The rules would kick in at the same time. Now, that will be a date to be set, but there might be specific arrangements if an industry had, or a business had a certain set of circumstances that required some critical workers to still attend work who'd been close contact. So that's something the Chief Health Officer would manage on a individual basis.
114 active cases in the state. Any idea how many close contacts are currently isolating due to those cases or in relation to them?
Do you know the answer to that? I don't have an answer to that. We can perhaps get an answer for you. But as I said, there's 9 cases today, 7,500 tests yesterday. Our caseload is very low by national standards. Nationally, I'm not sure I have the figures here, but nationally, in other states there was, here we are. In New South Wales, it was 13,333, Victoria 12,755, Queensland nearly 10,000, and the like, so it goes on. Across Australia, there were 40,176 cases yesterday. Western Australia's contribution to that was, I think it was 10, sorry. Western Australia's contribution to the 40,176 cases across Australia was 10. And so obviously we're in a very different position to the other states.
These rules come in when you have high caseloads. If we don't have a date for borders opening before that point, will the border be made redundant when these new testing requirements come into effect?
Not necessarily. As I've said to you before, border arrangements are crucial whilst the eastern states is peaking to keeping caseloads and case numbers here down. As I said to you, over east yesterday, there was 98 people died. 98. That's out of, since the start of the year, 1,255 people have died over east from COVID-19, and that doesn't include the thousands of people who have gone through hellish sickness. And so we put in place, you'll recall, when I made the announcement back in December about February 5, I put some criteria around it. I said if there wasn't a catastrophe or an emergency. Omicron came along and it was catastrophic and it was an emergency for the eastern states, and the death rate shows that to be the case. So we had to change our position based upon that, and deliberately bringing in hundreds of thousands of cases on the first day would have just meant, whilst we didn't have high third dose vaccination levels, massive increase in infections, and in particular, lots of older West Australians die. Now, I didn't want to do that. Obviously, that's had some blowback and pushback, but I didn't want to deliberately bring in something whilst we had low third dose rates that would kill large numbers, in particular of older West Australians. And we foreshadowed that. I foreshadowed that back in December to you all, standing in this room, that if there was an emergency or a catastrophe, and I think it is over there, over east, then we would change position. That's exactly what we did.
The numbers are slowly starting to drop over east. Do you have in mind numbers that you think you could loosen the border, you know, the numbers over east? What would you like to see them down to allow you to open up?
It's mainly about getting our third dose rate up. That's the main factor. So as I said, we're, what was it? I said 33% or thereabouts today. It's about getting our third dose rate up. But in terms of the numbers over east, the hospitalisation rate in New South Wales went up yesterday. The hospitalisation rate in the Northern Territory went up. The ICU rate in New South Wales went up. In Queensland it went up. In ACT it went up. And across Australia it went up. The ventilators, the number of people in ventilators went up in New South Wales, stayed the same in Victoria, South Australia, the ACT, but across Australia the number of people on ventilators yesterday went up.
The hard border is impacting some industries, particularly tourism in the Kimberley, Cunderdin especially. Will there be any sort of assistance for tourism operators, or will you look to consult with them at all?
Well, I think the Tourism Minister is having consultations yesterday and over the coming week with the tourism industry about all of these matters, but I just make the point to you all, across regional WA, the tourism industry has done incredibly well and better than ever before over the course of the last 2 years. So, of course, the last 2 years with West Australians holidaying at home, regional WA tourism has been incredibly strong. As some of you may know, I went to Exmouth, drove to Exmouth over the break. The tourism industry up there, and every operator I met told me over this period of time it's never been so strong.
If it's not case numbers over east and it's the third dose that we're looking to increase before border opening is reconsidered, can we have a number of when that will be reviewed? Like, can West Australians have some indication of what that third dose rate needs to be at for borders to be reconsidered?
As I said last Thursday, we'll review this over February.
I don't know, you've been advised on what the UWA Professor George Milne has said today, where he's done modelling which shows that Omicron could reach a peak of 430 cases in hospital and 43 in ICU at its peak. Do you have any comment on that?
No, I don't. I got told he did some radio and he said some things. I don't know exactly what that was, but I can tell you yesterday at National Cabinet we were advised, particularly the eastern states, to prepare for a fourth wave. So just because there's a wave that might peak at the moment, in particular in coming months, the expectation is there will be a fourth wave in the eastern states. In our case, that would probably be the third wave. But over there, it would be what they're terming a fourth wave. So I'm not exactly sure what wave it is here, to be honest, because we haven't really had waves like they have. But what they're saying is that potentially there'll be a fourth wave of Omicron in the east.
So sorry, they're not in that fourth wave now, you're saying that beyond that?
Correct. Beyond the existing wave, they're saying that this is the eastern states. They're saying there will be what they're terming a long tail, and they're strongly expecting a fourth wave, particularly over the winter months in the eastern states.
What would a fourth wave mean for the WA border?
Well, hold on, just coming back to us, as I said, our waves aren't exactly the same as theirs. So, you know, we've had, 12 days of lockdown. We've had one person in Western Australia acquire the virus here and pass away. So it's a very different situation here. Obviously, as I said, I'm not going to preempt our review. We'll do our review in February on the border, and we'll take into account vaccination rates in particular here in Western Australia. And the circumstances in the east will be part of all of the considerations.
The school rules are very complex. I found all that very confusing, to be honest. Whereas the New South Wales and Victorian surveillance model is quite easy to understand. They just give out rats to students and teachers, and if they're positive, they don't go to school, and there's no contact tracing. Why aren't you doing that model?
A couple of reasons, but I'll let the Minister explain in more detail perhaps at the end, but I just want to give you an overarching comment on it. New South Wales and Victoria are doing something different to Queensland and South Australia. So Queensland and South Australia don't agree with what New South Wales and Victoria are doing. The New South Wales and Victorian model is over what they're terming the very peak of the virus. So whilst it's at, whatever it is, tens of thousands of cases a day, they're doing this, and they're planning on doing it for a month. And that's the existing plan. They've had a very different circumstance to us, in particular Victoria. They've had months upon months upon months of students not going to school. And so they're using any measure in their toolbox to get kids back to school. And so, and they're doing it at what they think is the peak of the virus, although as I outlined to you before, there might be another peak coming. So our circumstances are very, very different. What we're trying to do with all of these rules, and I understand because I spoke for a long time, and the Health Minister and the Education Minister spoke for a long time, we're attempting to get the rules out early, provide huge amounts of information so that schools and businesses and industries and government departments can take it all in so that they are ready for the point in time in which it needs to be implemented. So over East, of course, they had to implement it on the fly when they had thousands of cases. Our situation, because we have successfully kept the virus largely out of Western Australia, we've kept community spread down. We didn't open up on February 5 and therefore bring in thousands of cases of Omicron. We're able to put in place these rules so people can understand them well in advance, and they're based upon the learnings of the East. When I finish, I'll let the Education Minister come and speak to you.
Can I just ask you, it's a case study, but the tennis player Matt Ebden, who obviously left WA believing he could come back to see the birth of his child, is now faced with missing that because of the backflip on the border.
So I'll just go back to, first I'll deal with those two issues. Health will obviously work with him and his family, and they do that regularly with cases like this. So in a sympathetic and understanding way. But we obviously have to balance a range of factors, his circumstances, but also the health of the people and the protection of the people in the hospital. So they'll continue to work in a sympathetic and understanding both with him and his family. To your other point, when I announced in December the opening of the borders on February 5, I clearly said if there wasn't a catastrophe or an emergency, I happen to think that 98 people dying today and scores of people dying each and every day in the eastern states is a catastrophe and an emergency which required us to change position, because otherwise we would be deliberately importing hundreds and thousands of cases into Western Australia, and lots of people would die that would have otherwise been avoidable while we get our third dose rate up. I'm going to keep explaining that so that that is well understood, that is what I said back on December 13 last year when I explained what we were going to do.
But you don't see that perhaps the irrational approach to that, given that someone like Ebden is tested every single day, either by himself or by the authorities over there, is about to play in a tennis final, so clearly he's healthy enough, and you're sort of putting him in a high-risk category.
Look, as we've said, people can come back to Western Australia. West Australians can return, particularly after February 5, subject to quarantining and other arrangements to ensure we continue to protect the health and well-being of West Australians.
You're taking that too far.
I'll explain to you.
Like that, it seems ludicrous.
I'll explain to you again. So what we are doing is trying to protect the health and well-being of West Australians. So we have a set of rules that allow for compassionate return. Cases like his, where there is someone whose wife is having a baby, there's other cases where there may be people with family members in palliative care and the like. The health department and officials will deal with them on a case-by-case basis in a sympathetic and understanding way to hopefully allow for them to see their wives, to see their family members in those sorts of circumstances.
A lot of this plan is predicated on rat testing, particularly at high caseloads. Who is the state going to be giving free rats to?
That's something that we'll work out soon, but obviously we're getting our rat supply up significantly. There's a whole range of other measures we're working out based upon watching the experience of the East.
On the discussion of rats, of rat testing, do you think priority for the supply of the tests should be given to regional areas due to the fact that in regional areas people face greater isolation and may struggle to access PCR testing?
I'll let the Health Minister go into that in further detail, but obviously our aim is to have extensive supply of rapid antigen tests all over Western Australia.
You said you want to get booster shots up to at least 80, between 80 and 90. The medical regulator has approved them for 16 and 17-year-olds. Are you going to include them in those numbers?
Haven't considered that, sorry Natalie. But obviously our booster rate goes up actually pretty strongly each and every day. This is climbing really fast. Because I think a lot of people have found they had their first dose and their second dose and they're fine. Even some of the people who are anti it, they're fine. And so having the third dose they now see as pretty easy to do, and it's not a risk to them, and it'll ensure that they have greater protection against Omicron. So we'll consider that factor.
These new testing and isolation protocols, are they only tied to high caseload numbers, or could they be introduced if we arrive at a high enough booster dose, or could they be introduced preemptively if the border were about to come down?
It's about higher case numbers. So it's about, all these rules are about higher case numbers. So the existing close contact and isolation rules continue until such time as we have higher case numbers.
If you had say a 90% triple dosed population, could you relax it from 14 days to 7 days like with these new rules?
It's based upon higher case numbers.
And I heard your explanation for why you can't give a definitive threshold, but is it safe to assume we're talking about thousands rather than hundreds of daily cases?
I can't answer that because it all depends upon circumstances. I'll give you one thing I think that is very pertinent here. You could have hundreds or even thousands of cases, but they could all be in quarantine and not infectious in the community. So it's obviously different to hundreds of cases that are infectious in the community. So it's very difficult to give a formulaic response and an exact set of numbers because there's so many circumstances that we need to take into account. But the good thing here is we watch what's happened in the east. We've actually gone between, if you like, the national definition and the South Australian definition. South Australia has 10 days quarantine, by the way. Under our rules, it'll go to 7 days. So we've gone between the two with what we think is safe, but also allows industries and agencies and hospitals and schools and everything else to continue to function. So it's a set of rules that are designed for the unique West Australian circumstance. We include the resources industry in it. So they are particularly in the critical worker definitions. And so it's complex, I know, it's complex and it takes a while to understand. But the idea here is we're giving industry and government and everyone else time to get used to it because, you know, you don't want to do it on the fly like they had to in the east because of their circumstances, giving people time to get used to it, and at a certain point in time they'll come into effect.
Now, you will reduce the quarantine to 7 days. Well, it means we may have more room for international travellers to return to WA?
When we reduce the quarantine arrangements for close contacts to 7 days, that would mean that people returning to Western Australia, the quarantine arrangements would also be 7 days. You good with me? I'll hand over.
Sorry, just one more. It made yesterday someone from New South Wales who was looking to return to WA from February 5 under the new guidelines has said she spoke to WA Health on the COVID hotline about how to upload her RAT result when she takes it, and that okay.
I'll let the Education Minister go first and then the Health Minister.
Thanks very much. To respond to your question, Peter, it is a balancing act between how do you manage what we know are going to be the pressures that arise from furloughing, how do you keep people safe, and how do you not disrupt education. We have the advantage of being able to observe what has happened as Omicron numbers, daily cases increased into the tens of thousands in New South Wales and Victoria, and to see that coming and to be able to plan. You're quite right to take note of what I read out to you is quite complex, but we have the time to make sure that everybody understands exactly what that will look like and how to make that work and to break it down as South Australia has done. I've seen the material they've provided to break it down into what it means for each category of the people that I read out. It is a balancing act. We want to keep schools open. We know we're going to have to manage furloughing, but we want to also keep people safe. We've got the opportunity to be proactive about that. The decisions that were made by New South Wales and Victoria meant that they're trying to retrofit how to deal with those issues. So that's the critical reason. It's how do you get that balance right, keep schools open so students can continue to learn and not have the kind of disruption we've seen on the East Coast, minimise the risk where you can, and manage the furloughing. It's about balancing those things.
Just confirming, I thought I heard at the start, those same school rules apply to the daycare and childcare centres as well?
Yes, but the point I made is that there'll probably be operationally some changes, and the Minister for Communities will work with the early years providers to work those out with them.
The schools plan is predicated on contact tracing, really, isn't it? Identifying contacts in the classrooms and that sort of thing.
By providing a definition, though, so you don't have to be traced.
Yeah.
You were either in the classroom or you were not. You were either working one-on-one or you were not.
Okay, so does that mean the administrative responsibility for identifying people as being contact falls on the school?
Yes, but they will have the clear definition of what that means, and every single adult working in that school facility will know where they fit. I'll add that, of course, parents will be notified when a positive case is found, but that's why we're giving the information out as early as we possibly can, providing schools with the advance notice that they need so that everybody understands what the arrangements are. There's no question. 2022, the first half, is going to be bumpy in education. It's going to be bumpy. We need to put the plans in place, have them clearly articulated, clearly explain to people, have all of the information out there that people need to know to make them work, and then proceed.
And then, say your kid is a contact or has COVID and goes home for 7 days minimum, does their education stop for that week, or what's the plan?
It will depend on the particular circumstances, but can I say this? All of the plans are in place. They were in place at the end of last year for work packages, access to online resources, and we'll have to work it out operationally depending on the actual numbers in a sort of cohort, in a class group. There may be the capacity to pivot to online, but it'll be a combination of those, a choice of those three elements.
Do you have an updated number on updated percentage on how many teachers have provided proof of vaccination, and how are staffing levels looking for Monday?
I don't have the number with me, I'm sorry. It would have increased from when I last spoke to you. Plans as for Monday are looking good, but I won't actually know until Monday. Thanks very much.
On the question of regional communities and RATs, look, aware of the challenges that regional communities face in terms of accessing testing. So we are in the process of pre-positioning RATs in those communities, not just at the major regional centres, but in more remote communities as well, and working closely, particularly with the Aboriginal health providers, to make sure they have access to RATs as well.
How will self-reporting of positive rapid antigen tests be policed?
Well, there'll be reporting of both PCR and RAT tests. It does require people to be honest and to upload the picture of their positive or negative RAT test as required by the health department.
Can I just ask a question on masks for the Wheatbelt? What are the regions for the Wheatbelt? Because I understand people in Lancelin are saying that they're not part of the Wheatbelt region.
Well, whatever the clearly defined regions of the Wheatbelt are in the mask mandate. So
So the usual
yes,
definition.
the standard definition, the agreed Australian geographical definition.
It's under the Regional Development Commission's Act.
Yes, so of what those towns and regions are, and at the moment it's a Great Southern as well. And as the Premier flagged, we will be extending it to other regions where necessary. We obviously want to keep people safe, particularly in those regional areas.
Just a question on the border up near Cunderdin. My ABC colleagues up there have been hearing from dozens of people who live in Cunderdin but were caught on the wrong side of the border when that border reopening date was cancelled. Now trying to come back and drive back, they get to the border with a G2G that's been approved, but then they're told they can't pass through and they have to fly to Perth or drive to Eucla. Is that reasonable?
Well, look, under the current border arrangements, they need to have an approved G2G pass under the current arrangements. So I know that police are working with a number of those people and making sure that they can get through where they need to, and we're looking at those specialist skills in particular who were heading over after Feb 5 to make sure that they can get through under whatever new arrangements are required. But those people are in contact with police and we're working with them to make sure that they can get through.
But if you don't have a specialist skill, you have to return to Darwin and fly to Perth.
I don't have the details in front of me about, and I think the police will work through that. But there have been border arrangements, in particularly in the Midwest region and the northern regions, because of the significant outbreaks in the Northern Territory, particularly in remote communities. There's an entire community that's been locked down in the Northern Territory today, and there's a lot of movement between those borders, between groups. So the aim is to protect those communities as much as we can.
Someone from New South Wales was applying for a G2G pass to get into WA from February 5 under the new arrangements, and was told that the person on the hotline hadn't been informed about how rat tests would be uploaded to the system and how that process would go. Is the COVID hotline staff being updated sufficiently?
There are increased resources on the COVID hotline, and staff are trained regularly and updated on all of the new arrangements. I couldn't comment on every conversation that they have.
But they are being trained on how rat tests will be uploaded, and can you give an indication of what that process is like?
Look, no, I couldn't at this point tell you exactly what training is being undertaken by the police, but they are being trained and certainly being resourced because we do have an increase in those applications.
Is that also an honour system with people from the eastern states uploading negative rat tests? Is that
It does require the community to be honest with uploading those pictures of rat tests, yes.
Last question. Chief Health Officer, please. Apologies, Brendan. Are you likely to recommend the introduction of gathering limits and capacity restrictions before we get to this undefined high caseload?
So we, as the Premier's outlined, we are looking at all of the measures, and we obviously will look at what the caseloads are going forward and what makes up those caseloads. And I'll provide advice to government as to what measures, additional measures may be required at that time.
Have you already recommended some restrictions?
The restrictions I've recommended have been implemented. So the current mask restrictions, for example, the proof of vaccination restrictions have been implemented.
Is your modelling sort of similar to what George Milne spoke about today? 400 sort of a peak of 400 hospitalisations, 10% of that in ICU. Is that similar sort of data to what you have?
So we've worked with Professor Milne at different times. I'd have to look at the parameters he used, so it's very hard for me to say whether our modelling's similar or not. He's made some assumptions, but without seeing the modelling, I can't make a comment on that.
You also made the point that you think there's some benefit to Omicron coming in and people who are vaccinated catching the virus and therefore strengthening their immunity. Do you think there's any? Is he correct in saying that?
Look, we wouldn't recommend that. I think.
Why do you think he said it then?
Sorry,
why do you think he said that?
Why did
Is
Professor?
it irresponsible? Is it an irresponsible comment?
Why did Professor Milne say it? That may be his personal view. I'll point out Professor Milne's a mathematician, and so that's a personal view. I make the point. if you get infected with Omicron, it will protect you against Omicron.
When might
It will not protect you against future variants, and you strongly need to look at getting vaccinated, because vaccines, particularly if you had all 3 doses, will protect you, as we've seen now, against not only the Alpha, Bravo, Delta, Gamma variants, and now the Omicron variant if you had the 3rd booster. So just going out to get infected.
I don't think he was saying going out and getting infected. He's saying if you've got your 3 doses and you were infected now, but he's in the community, you're going to have a. Yes. Look, we all accept that there is a chance that even with 3 doses you may become infected, and that will provide you with some further protection in the future. But that's on the basis of having. That's what I meant. Sorry.
Three on the basis of already having 3 doses. Yes.
Final question.
When might the public expect to see some of the Omicron modelling that you've been working with?
So will the public see? We're obviously continuing to refine the parameters. There are still a number of questions on the model parameters, and that's still information that's developing. How effective are the vaccines? How much protection do you get from boosters? What are the kind of things that how do they wane? Do they wane quickly or not? They're all questions that we are still getting data on. How much seeding we might expect when we open the borders, those kind of questions, and what impact that might have. So they're all kind of questions and parameters that we would need to put into a model going forward.
Just one more. Boosters started to become available November 8, I believe.
Yes.
After how many weeks would you expect the level of protection afforded by boosters to wane? After how many weeks?
At the moment, we've got good evidence that we've got good protection from the boosters, but we do anticipate, like all vaccines, that they will wane over time. But we don't know. As the boosters, as you said, the boosters have only been given in most parts of the world in the last 2 months, and obviously we're not anticipating. We're anticipating very little waning at this stage, but to extrapolate that out, we can't do at this stage because we don't have sufficient information.
Thanks, everyone.